Hi, my name is Jasmine, and today I'm going to be discussing the breastfeeding challenges of blocked milk ducts and tongue tie using the situated clinical decision-making framework. This will appear backwards, but it's just an example. The situated clinical decision-making framework consists of knowledge, cues, judgment, decisions, and evaluation of outcomes. Starting with knowledge, what do we know about these two breastfeeding challenges? For tongue tie, about 3 to 5% of Canadian babies are born with a tongue tie, and my son Mikhail was amongst those babies. I was going to use him as an example. Unfortunately, he has a fever, so he's a bit fussy, so he won't be participating with us today. A tongue tie, or ankyloglossia, is a congenital anomaly where the lingual frenulum has an abnormal attachment that can affect the way the tongue moves. There are 4 different classifications of tongue ties depending on where the frenulum is attached. Class 1, the tie is attached to the very tip of the tongue, as you can see right there. Class 2, which is what my son Mikhail has, is further behind the tip of the tongue. Class 3 is closer to the base of the tongue, and Class 4 is the base of the tongue. Some posterior ties may also be submucosal, and they must be palpated to diagnose, so pretty much you have to push it back and that's when it pops up. Babies with this kind of tie are often misdiagnosed as having a short tongue. Now, moving along to blocked milk ducts. What are they? A blocked milk duct is an area of the breast in which the milk is blocked and is unable to flow down through the ducts and out of the nipple. Here is an example of the anatomy of a normal milk duct versus a clogged milk duct. Here's a zoomed in. As you can see, it's blocked versus not blocked. The causes of blocked ducts are milk stasis or restricted flow resulted from infrequent or skipped feedings, inadequate removal of milk from the breast, localized pressure on the area of the breast, and other causes also can include stress, fatigue, anemia, and a weakened immune system. Now, going into cues, which covers signs and symptoms, I'll start off with the signs and symptoms of tongue tie. So for the baby would be unable to latch or maintain a latch, have a shallow latch, unable to maintain a seal, and or milk may flow out of the sides of the mouth, making clicking or smacking sounds, prolonged feeds, and maybe unsatisfied following these feeds, poor weight gain, unable to keep pacifier in his mouth. Some of these symptoms were experienced with my son as well. Also noticed that babies with tongue tie, they don't have the flanged lips over the areola, which they should be. Instead, their lips are pursed against it, and then there may be a crease that may be formed after feeds there. I did witness this with my son, but we were able to work it out after we have achieved a better, deeper latch. Also, signs and symptoms for tongue tie with mothers could be a creased or flattened nipple following feeds, nipple trauma including cracks or bleeding, severe pain with latching, plugged milk ducts, as we had mentioned before, mastitis, and they may also experience engorgement or thrush. Now, moving on to blocked milk ducts, the mother will experience pain and tender within the breast. The plugged duct tends to be more painful prior to feeding, and during the feeding it may be extremely painful when the letdown occurs. There is usually less pain following the feed because the duct may have then been emptied. There will also be a noticeable lump, especially with palpation. Lump can decrease in size following a feed, again because it's now been drained. There could be swelling, redness at the area of the lump, may have reduced milk flow, and also may have a low-grade temperature, less than 38.5 degrees Celsius. Now, going into judgment, which consists of 3 priorities for nurses. Number 1, get the milk moving and to unblock the duct and to prevent mastitis or an abscess from forming. Number 2, give the mother information on treatments available for tongue ties, including surgical release of tongue versus leaving it alone, so the mother can make an informed decision on the treatment of her baby. And number 3, help mother to nurse her baby pain-free by assisting her with the positioning to alleviate symptoms and to further prevent a reoccurrence of a blocked duct. Now, in order to help mothers achieve these three things, we as nurses need to teach her how to care for the blocked duct at home. So put in a lactation consultant referral to review latch techniques to essentially achieve a more comfortable, deep latch, regardless of her decision on having the tongue released or not. If she has made the decision of having the tongue released, then another consult needs to be made to a physician that can conduct the procedure. Now, looking at the decision piece of treatment for tongue tie, with a tongue tie there are two available treatment options. As I'd mentioned, leave it alone and work with a lactation consultant on trying to achieve a deep, more comfortable latch, or the second option would be to have the procedure done, which is known as a frenotomy, which is done that releases the tongue tie. Now, if the mother is considering having the tongue tie released, she needs to be aware that there will be some bleeding. Her baby will cry during the procedure, especially when there's going to be fingers and stuff in the baby's mouth. They're not going to like it. So they will be crying. And there's also some post-care exercises that the mom will have to do, which involves stretching the tongue and rubbing the incision site. The majority of tongue tie releases are done in physician's office, and it's usually a very quick procedure. The doctor uses a notched tongue elevator and just lifts the tongue right out of the way, uses sterile sharp scissors to cut the frenulum, and many mothers notice the latch is more comfortable like right away. However, just do keep a note in mind that frenotomy may not be required for many babies due to them not having any issues with nursing, which is the case of Mikhail. I mean, we did have issues, and babies may have issues initially, but once you're able to work it out and figure out correct positioning, correct latching, it may not even be done, need to be done, so we didn't need to have it done. Now, taking a look at treatment for blocked milk ducts, it includes frequent nursing of the baby. If the feeding is too painful during the letdown phase, the mother can start on the other breast until the letdown has occurred and then move back to the breast with the block. If she finds nursing too painful altogether, she can hand express or pump from the affected side to further prevent mastitis or an abscess from forming, just to make sure that she is draining that side as well, even if she doesn't want to feed from that side. She can try different feeding positions, and she should try to line up the baby's chin to the area of the block to help achieve best drainage. Prior to nursing, she should also apply warmth to the affected area. So this can be done with a warm cloth or taking a disposable diaper, filling it with warm water, and placing the diaper right against the breast. Or ultimately, she can just take a warm shower. She should also gently massage the area, working from above the lump and moving down towards the nipple. She should also do this during feeds. She can take pain medications such as ibuprofen and Tylenol to help with the pain and low-grade fever, and ultimately also apply cold packs following feeds to reduce any swelling. Make sure she's also aware not to wear any tight restricting clothing, and like all mothers are told, get plenty of rest, eat a well-balanced diet, and drink plenty of fluids. Now, evaluation of care involves following up with the mother to see how things are going. How is she feeding? Was she able to unblock the milk duct? How is the breastfeeding going? Was she able to achieve a more comfortable latch? If she had the infant's tongue released, how is it healing? Does she have any other concerns or questions? Furthermore, always remember the 3 E's of breastfeeding: early and often, effective feeding, and exclusive feeding. Also remember the 3 rules of breastfeeding: feed the infant, move the milk, and help the dyad learn to breastfeed. By remembering and applying these rules, it'll help prevent blocked milk ducts and promote a positive breastfeeding experience for the mother-baby dyad. Thank you for watching, and I hope that you have learned something new.